presentation is about the self-care essentials. For you to be fit for work, fit for life, fit for the things you want to do, it makes sense for you to have some knowledge of the fact that your body needs to be taken care of and cared for well. I'll give you some hints that might help you in this process. These are the things you should know about protecting your health. My name is Tom Haney, and I'm classified as a health and productivity risk management specialist because my goal is to help you to understand what might keep you healthy on and off the job. Let's start with this. We do know that sometimes it gets very complicated to try to figure out what do I need to do to stay healthy, because we get conflicting information and things change. You know, one day this is good for you, the next day it's not. I understand that. But the thing is, the best we can do is present to you the state of the art. What do we know now to be true? And if it changes, we'll try to tell you how it changed. So you're not alone in this process. Your employer can offer some help, lots of help. Your healthcare provider, your health insurance companies, your family, and you are all engaged in this process of trying to keep you healthy and fit. Now understand some of the basic considerations here. 75% of the healthcare costs in our country are related to chronic diseases. What's a chronic disease? It's a disease that's long-lasting and can't actually be cured, but is simply managed. That is a concern for us because it's driving most of our healthcare costs. But what we now know is about 70% of chronic disease is avoidable. You don't have to have these things happen if you choose to live your life in a certain way. This just happens to be a chart of the leading causes of death among females. Heart disease, cancer, and stroke lead the way, and you can see the rest of them. For males, it's heart disease, cancer, unintentional injuries, because we're not as smart as our female counterparts, and stroke is number 5. You can see that there is some commonality among the things that happen to both males and females in terms of our health and what puts us at greatest risk. My goal is to help you to reduce the risk. Can't bring it down to 0, but we can dramatically reduce our risk of developing what are these chronic diseases: heart disease, cancer, and stroke. So we've been able to figure out that they are avoidable based on certain lifestyle choices that you make. And here are the things that we've now been able to assume to be the most important in managing the risks of chronic disease. A lack of physical activity, overeating, poor diet, tobacco use, alcohol excess, and unmanaged stress. So those are the ones we're going to focus on today and try to get through these, just to give you a touch of some of the things that you can do and should be aware of. Remember, it is what you do that determines what you become. It's not just a matter of fate, luck of the draw, having the right genes. It is overcoming whatever limitations you may have by living a healthy lifestyle. It's all about reducing risk. That's the key. Let's start with overweight and obesity. It is certainly a problem in our country, perhaps more than some others, that we are tending to become larger over time. I'll give you a little statistic that might make a sense. First of all, we measure obesity or overweight in what we call the BMI, or body mass index. Some of you may have had that done, and it's a way to correlate height and weight so that a healthcare professional can make some statement about whether or not you are perhaps at a higher risk of developing chronic disease. So in let me see if I maybe pictures, the graphics might be better. In 1990, you can see the ideas down here. Most of the country was between 10 and 20% in terms of body mass index, or percent of body weight that was fat. By 2000, only 10 years later, it was a dramatic change, and now a large portion of the country have between 25 and 29% overweight or obesity. And by 2010, again, another only 10 years. In 10 years, the majority of the country was now in the area of having roughly 30%, or 1 in 3, that were obese. That is a remarkable change over a very short period of time, in a risk factor that we know is related to a lot of conditions. For example, diabetes, heart disease, GERD or acid reflux, high blood pressure, cancer, sleep apnea, and joint problems. Many are associated with obesity. So it is a problem for us to be carrying too much weight, especially non-productive weight, in the form of fat. So what drives this? Well, of course, poor eating and poor diet. I just found that graphic, I thought it was cute. You are what you eat? Well, to some degree, that's true. So what should we be doing? Well, in order to be smarter about what you do from a nutrition standpoint, reduce your portion sizes. Just because you can supersize for an extra quarter doesn't mean it's a good deal. Does not mean it's a good deal. Or because you get a huge portion at some particular restaurant, unless you take half of it home, it's probably not necessarily a good deal. Eat more fruits and vegetables. You know, the human body requires certain vitamins, minerals, phytochemicals, antioxidants, and most of those come from fruits and vegetables. That's what we were designed to eat. So we should have plenty of those. And you should choose lean sources of protein. The fat that's often associated with animal source proteins is a saturated fat, which is one that we find closely associates with heart disease and certain kinds of cancers. Consuming more fiber or whole grains. We know that fiber keeps you regular and it helps to reduce your cholesterol levels. So whenever you have something that contains grains, try to get whole grain fibers or whole grains as much as you can to increase the amount of fiber. Reduce the amount of fat in your diet. That does take some thought, but if you read labels, that's a big deal. Reading labels will help you to understand how much fat is contained. And when you have visible fat, try to take it off, try to cut it off if you don't eat that. Salt and sugar, now they're not directly related to each other except that they both are flavor enhancers. And the problem is both of them have concerns. Salt, because of its effect that it has on our blood pressure and other things. And sugar, because of the number of empty calories and the fact that it often will satisfy your hunger without giving you the nourishment that you literally need to have. So be particularly cautious about how much salt and sugar you consume, and drink water. Do you know, I think among all the mammals in the world, I think we're the only ones, humans that is, that consume anything other than water after weaning. No pop, beer, alcohol, tea, coffee, no, water. That's what we're designed to drink, and we need quite a bit of it because of the amount we lose through perspiration and so on. I just thought that was a cute little slide. I threw it in there just because a lot of people are not big on fruits and vegetables. I wanted to make the point that it's your choice. You're an adult. You can make the choice to eat smarter. You have to outgrow some of these things that may have happened over time and start to make better choices. Physical activity, a risk factor for sure. So what do we know? We know there's a minimum requirement. That was not hard to figure out because when people were bedridden, they deteriorated at an enormous rate. So we knew that there is some level of physical activity that people required to stay strong and vigorous. Vigor is a big part of it. Energy, able to do things. It does have a relationship to health. We know that people who are regular exercisers tend to have lower risk of heart disease and diabetes. We know that aging is a concern. We're all going to face it. But with aging, for many people, what happens is they lose the ability to do things, especially physical tasks. Well, physical activity can help to diminish that negative consequence of aging. And of course, just basic function. To be able to do what you want to do or what you need to do, all based on keeping yourself at a certain level of physical functioning. The general recommendation, this is not specific, but general, is do something every day. It could be as simple as taking a walk. It could be going to a gym. It could be taking a class. It could be riding a bicycle. It could be lots of different activities, but try to do something every day. Tobacco use. At this stage, we know so much about tobacco use and its negative consequences that some people don't still realize that tobacco use is the #1 cause of preventable death in our country. Still drives a lot of our health issues is the use of tobacco. And we'd still classify tobacco use as the single biggest driver of healthcare costs. It's why in most circumstances when you're having a physical or dealing with an issue, one of the things they'll ask you is, are you now or have you ever been a smoker? Because it is so consequential in terms of your long-term health. If you still smoke, there are lots of ways that you can quit. It doesn't have to just be cold turkey and willpower. There are lots of resources that you can get and take advantage of that can really help in the process. But it is absolutely worth it to quit smoking if you're still doing it. Excessive alcohol use. We do know that excessive alcohol use is associated with certain health issues, but also, of course, with accident issues. A fairly substantial amount of the number of the deaths that occur from motor vehicle accidents are associated with alcohol use. So it's not a benign substance. It can cause health issues and it can cause serious other issues as well. And we also know that there's psychosocial issues. Some people simply can't use alcohol without becoming somebody who the rest of us don't want them to be. They become angry or bitter or argue over everything or can't have a simple conversation. They're mad at everybody. That's a problem. That should tell you. If your friends start telling you, no, I don't want to go out drinking with you because you're getting miserable, listen to them. You're not a good candidate to be using alcohol. The recommendations are no more than 2 drinks a day for men and 1 drink a day for women. And by the way, that's not cumulative. What do you mean? I mean, just because you didn't have anything to drink Monday, Tuesday, Wednesday, Thursday, doesn't mean you can add up these and have a binge drinking on Friday. No, this is in any 24-hour period. And of course, no adolescents should consume alcohol for all kinds of reasons, but the health issues get exaggerated among younger people. Everyone, and hopefully every one of you, has a personal physician. You do not want to use the emergency room as your personal physician. They know virtually nothing about you when you go in there. You want to have somebody who knows your history, knows your family history, what medications you're on, can determine if you're staying compliant with your screenings. You need a personal physician to monitor your health long term. But you have some responsibilities in that. You have to take some responsibility. What do you mean? I mean, if the doctor tells you to change something, then it's your responsibility to change it. Lose some weight, stop smoking, whatever they happen to be, you need to own that responsibility and make those changes. Practice medical self-care. When you think something isn't going well, but it's not at the level of seeking medical attention, well then deal with it in a smart, appropriate manner. Ask for advice if you need to, but try to deal with some of those. Be honest with your physician. They're there to help you, and they've heard it all. They've seen everything, things you wouldn't even imagine. Be honest. Tell them everything that you are concerned about, whether it's physical or psychological, to help you stay healthy longer. There's going to be a lot of poking and prodding in your physicals. That's the nature of it. Doctors need to use all of their senses to try to determine your health status. So deal with it. You're an adult. You can deal with all of that. It's a slight inconvenience, but it's not a big deal. If your health insurance company offers a 24-hour medical helpline, use it. It can be used for emergencies or urgent calls. They can give you advice on what to do. They may even be able to direct you to the closest provider if that's necessary. But you can often even ask general questions. You're dealing with a healthcare professional on the other end of that phone. And if you have questions about what should I do, how is this, my doctor told me to take 2, is it okay if I take 3? They're not going to change your prescriptions, but they can answer questions. They are healthcare professionals. Know your numbers. This is a way for you to track some of the greatest concerns you have in terms of developing chronic conditions. Know your blood pressure. We want it to be less than 120/80. You can monitor that easily by getting a blood pressure cuff or by going into one of your drugstores or grocery stores and using one of their devices. But you should know that number, and if it starts to exceed that or starts moving up, talk to your doctor about that change. Cholesterol levels, a little more complicated because it probably requires a blood draw, but your total cholesterol should be less than 200. Your LDL, or what's considered the bad cholesterol, should be less than 100, and your good cholesterol, we would like it to be over 40 for men and over 50 for women. That is cardioprotective to have a high HDL, so we want those to be up at a higher level. And then your BMI, we want it to be less than 25, and that's a chart you can get online, you can see in your doctor's office. Pretty easy to get access to the BMI chart, but you simply find your height and your weight, and you come to where the two of them meet, and that is your BMI, and that number should be less than 25. Oral health. It is imperative that you understand that what happens in your mouth can affect the rest of your body for sure. So daily brushing and flossing makes sense. An annual or greater, more frequent visit to the dentist for professional cleaning is a big advantage and an assessment. Avoid tobacco, limit alcohol, and eat wisely. All of those will contribute to oral health and limit some of the exposures you may have to risks associated with poor oral health. Stay current with your preventive screenings. Early detection is a major factor in success of cancer treatment, as an example, but you need to make sure that you are doing the appropriate screenings. Mammograms, pap smears, colorectal screening, these are necessary for you to understand what your status is and if you need to have some sort of medical intervention to keep you on a healthy path. Colorectal screening, of course, it can be invasive, and it does take some prep and all those kinds of things generally, but there also are simpler ways to do that as well. But colorectal cancer is a serious issue, and it's a bad way to die. So you want to make sure you're doing your colorectal screening, and generally it's people who are 50 and over who need annual colonoscopies or colorectal screening. But if you've had a polyp or a family history, they may recommend that you have it more often. When it comes to your medications, take them as directed. Follow the recommendation of your doctor, not the person working next to you or your aunt who says it's okay to take more, I've done that before. No, follow the recommendations of your healthcare professional, your doctor or your pharmacist. Be aware of the side effects. Talk to your pharmacist. These are experts in understanding and knowing the medicines that you may be on. That's a great resource. They're easy to talk to. They're very well educated. Use them. And of course, don't stop taking medications or change the dosing without talking to your doctor. And always mention any sort of medications or supplements that you might be on when dealing with your doctor or pharmacist, because there are interactions that could put you at great risk. Preventing medical errors. There certainly are medical errors. That does happen, so a couple of quick thoughts. I gave you before the list of leading causes of death in the United States, and in this case, preventable medical errors accounts to about 100,000 people a year. Play an active role in your health care. Ask questions. Be participatory in the process. Choose hospitals and doctors that have experience in dealing with your particular ailment or complaint. And I'm going to make a quick comment about hospitals. Where in the world could you possibly be surrounded by more sick people than in the waiting room at a hospital? It's not a great place. You don't want to take your kids. Say, yeah, they want to see grandma or mom or dad or something. I understand that. But the reality is, do you really want them exposed to all of the things that are happening in a hospital environment? Be careful. If you can use out clinics, televisits, be sure that you are smart about your hospital use. And of course, these are some basics. Read the instructions on your prescriptions. There's usually a little insert that comes with the prescriptions. Read it. It tells you about side effects, tells you about dosing, tells you about things you might not be aware of that could affect your ability to use this medicine effectively. And there are lots of medicines. Sometimes one medicine may not be doing for you what you want it to do, or in fact may be causing you harm. Another medicine for the same problem might not affect you in that same way. So read the instructions, get an advocate if you're not sure, if you need somebody to go with you to the doctor. Oftentimes it's a spouse or a good friend who you're not uncomfortable with them knowing about your medical histories, so they can hear what's being said and you can compare how you both understood what the doctor said. Having an advocate works for lots of people. And understand the course of treatment. Don't be afraid to ask, how long will this take? What will happen? How will it progress? How will I know when I'm done? Ask the question so that you feel as though you know what you're doing and how you and your doctor are working together to resolve your issues. So staying healthy is a big deal. It does involve better eating, regular exercise, and a positive attitude. If you do all of those, you will more than likely lead a long, healthy, and productive life. Thank you.